High blood cholesterol and hypertension. What's the connection between high blood cholesterol and hypertension? Having one risk factor for heart disease means you need to be careful. Scientists have found that when people have more than one risk factor, like high blood cholesterol and high blood pressure, these factors work together to make the risk of heart disease much worse. Even if your cholesterol and blood pressure levels rise only slightly, when both are in your body, they can interact with each other to more quickly damage your blood vessels and your heart. If not controlled, they eventually set the stage for heart attack and stroke, as well as other problems like kidney malfunction and vision loss. So, when you've already been diagnosed with high blood cholesterol, watch those blood pressure numbers like a hawk. These two risk factors like to hang out together. However, if you're aware of what's happening, you can win the battle for your health. High blood cholesterol can lead to hypertension. If you've been diagnosed with high blood cholesterol, you may already be taking medications to control it. And you may have made some lifestyle changes to help lower your cholesterol levels naturally. Meanwhile, it's important to keep an eye on your blood pressure. People living with high blood cholesterol often end up dealing with high blood pressure as well. Why would that be? First, let's look at what high blood pressure is. High blood pressure, or hypertension, is when the force of your blood pushing against the wall of your blood vessels is consistently too high. Cholesterol is a type of lipid. It's a waxy, fat-like substance that your liver produces naturally. Imagine that garden hose again. If you're out watering your small plants, you may turn the water on at low pressure so as not to damage them. However, if you are watering a row of shrubs, you can increase the water pressure to get the job done faster. Now imagine that garden hose is several years old and full of grit and grime. It's also a bit stiff with age. To get the water to come through at the pressure you'd like, you have to turn up the faucet to high. The higher pressure helps the water blast through all that gunk inside your hose so you can still use it to water your plants. If you have high blood pressure, your heart and your arteries go through a similar scenario. Because the arteries are stiff or narrowed, perhaps because of high cholesterol buildup, your heart has to work harder to pump the blood through them. It's like your heart has to turn its faucet up too high and blast the blood through to get enough oxygen and nutrients out to all the body organs that need it. High blood cholesterol and hypertension work together to damage arteries. Over time, this high pressure damages your arteries and other blood vessels. They just aren't built to manage a constant high pressure blood flow. As a result, they start to suffer from tears and other types of damage. Those tears make nice resting places for excess cholesterol. That means that the damage high blood pressure creates inside arteries and blood vessels. It can actually lead to plaque buildup and narrowing of the arteries due to high cholesterol in the blood. In turn, your heart has to work even harder to pump blood, putting excess strain on your heart muscle. The two conditions are like a team of villains working together to make things worse for your heart, arteries, and overall health. Indeed, over time, high blood pressure and cholesterol can cause problems in your eyes, kidneys, brain, and other organs as well. High blood cholesterol and hypertension, an unhealthy partnership. Researchers have known for a while that high blood cholesterol can lead to high blood pressure. In 2002, they separated participants into 3 groups according to their cholesterol levels: low, medium, and high. They then tested blood pressure under various conditions of rest and exercise. Those with higher cholesterol levels had significantly higher blood pressure levels during exercise than those with lower cholesterol levels. Moreover, the researchers concluded that even mildly increased cholesterol levels could influence blood pressure. On the other hand, cholesterol seems to mess up how blood vessels contract and release. Also, this can also affect the pressure needed to push blood through them. In fact, it seems that the presence of high blood cholesterol may actually predict a future presence of high blood pressure. Take steps to control both risk factors. The good news is that both of these risk factors are very manageable. Medications are available that are effective at keeping both high cholesterol and high blood pressure under control. The important thing is to stay in communication with your doctor, and to watch your numbers carefully. You can also adopt lifestyle changes that can naturally fortify your heart and blood vessels and help you resist any damaging effects. So, try these tips. Don't smoke or quit smoking. Stay active. Exercise for at least 30 minutes per day and resistance training twice a week. Eat a healthy diet that includes lots of whole grains, fruits, vegetables, lean proteins, and healthy fats like those found in fish and nuts. Avoid excess cholesterol in food, excess fatty foods, excess sodium, and excess sugar. Note: understand the causes and prevention of the disease to promptly treat the signs and symptoms of the disease. The goal is to solve your problem. So be open-minded and willing to experiment. At the same time, choose your strategy, take action, and start enjoying the benefits. However, if you run into two problems at once, get the important one under control first. Reference: How to Lower Blood Pressure Naturally by Exercising Anytime, Anywhere, 2 months free trial. Reference: The One Food Cholesterol Cure, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit farlandarfa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.